We needed to drive a consumer-driven transformation at Aetna because getting consumers engaged in their healthcare is what's going to be critical to addressing the challenges we have with our healthcare system. What makes Aetna unique in our ability to engage consumers is, at our core, we have been for a while a company focused on the outreach to our members. We have, and this is before even the merger with CVS, we've had thousands of nurses and social workers on the ground in local communities working with our members when they need us. We also have ramped up, and I'm sure other healthcare companies have, our analytics capability, our digital technology capabilities, but we are also building a marketing organization that is focused on empowering members and helping them in driving behavior change in a positive way. I came in and changed the way we did marketing. Instead of just simply having a plan and just launching it, to getting all of our teams, marketing, analytics, all of our agencies, our distribution partners together every day, going through and figuring out, what do we want to test? How is that going? How do we need to move the money around? What do we need to optimize? How do we need to think about, okay, we're doing better here. If we're getting better responses upstream here, that means there's going to be more calls in the call center. We better get the capacity up. And we've got to load balance, and we've got to do all of this fast. And we've got to take advantage of what's working well and ride it. And when things aren't, we've got to change it quickly. We believe there's a new definition of the network that we have to think about beyond clinical. We need to think about things like social services, like Meals on Wheels. People need to be able to have food, have nutrition, especially, let's say they're coming out of the hospital, they can't necessarily cook for themselves easily. We want to make sure that they're getting meals for a stretch of time. Transportation services, other kinds of support services in the home and in the community. We see that as a next layer that's going to be quite critical to solving people's needs. Inevitably, people are also going to say digital, right? Of course. But I think it's important to recognize that it goes beyond the technology. Of course, we're going to need more in terms of telehealth, wearables, things like that. But I think what's often not understood enough is all of this social support that people need.